Hello, my name's Barbara Hakin and I worked in the NHS for over 40 years, as a GP initially, but later as a manager working in NHS England. So I have a lot of experience of NHS services and the people in them who want to do the best for patients. I believe that the NHS has always wanted to listen to patients' views and take them into account in the way it shapes the services it delivers. But we've never really had a way of getting information which was in large enough volumes, which was consistent, or which most importantly was real-time information that we could analyse so that we could look at those patients' views and get the right insights so that the changes could be made. PEP, the Patient Experience Platform, offers a novel and unique way of doing that, a way of consistently drawing information from patients across the whole country to understand what their experience of care is and how that care can be improved. PEP, the Patient Experience Platform, offers the opportunity that the NHS has been missing. Huge volumes of data across the whole country, consistently connected and analysed, and has demonstrated that it shows not only about patient experience of care, but can help us with safety issues. The report that's just been published gives the high-level outcomes of that research and can show across regions, across ICSs and across different healthcare institutions some worrying variations about patients' experience of their care. And sitting underneath what's in the report, there's also a wealth more of information which allows you to drill down so that we can not only talk about the individual hospitals, but look at what's happening in the different departments. So I believe that PEP offers a great tool for boards of both providers and commissioners of NHS care to really get to grips with what patients are thinking and what patients are experiencing and make the changes that they need to on the back of that so that their patients get better quality and a better experience.
Hi, my name is Megan Lever. I am one of two co-founders of PEP Health. PEP Health is the patient experience platform. So I have a background as a psychologist. I spent several years studying health systems and patient safety and really trying to understand how we make a difference in terms of quality improvement across healthcare settings. I spent the last couple of years advising the UK central government and NHSX on their AI and machine learning adoption across the clinical domain. And I support PEP Health in their journey to commercially scale across the NHS and to really improve the quality of patient experience across the UK.
And hello, my name's Dr. Mark Lomax. I'm the Chief Executive of PEP Health. I'm a medical doctor by training, but now very much a clinical entrepreneur. My passion is finding technologies that make a difference within the world of healthcare, ideally improving patients' experience, but also reducing cost and improving outcomes across the whole system. And I've been the chief exec for the last 2.5 years at PEP Health. Today at this briefing, we're really excited to give you a bit of a showcase about what PEP Health does. We're going to talk a bit about why we do it, how we do it, and most importantly, what kind of insights we generate from the work that we actually do.
So the patient experience platform was developed in 2018. It was developed by UK Dutch SME. So we're based mostly in the UK, one of the co-founders based in the Netherlands. And it was two healthcare leaders who really envisaged a better, faster way of listening to patients. So what we developed is unique IP and AI technology that generates practical, real-time insights about what patients really think about their care. We are the only empirically proven methodology that's specialized to healthcare social listening globally. And the reason why we do this is really so that hospitals can know their providers. We can provide real-time feedback on all providers across England, creating an unbiased picture of trends, variations, strengths, and weaknesses across the system. We believe this will transform the way patient experience is understood and unlock the quality improvement that's needed across the NHS. We've had a great year, or a great past couple of years. So we are funded by Innovate UK. We're part of the NIA. We're the only patient experience tool that is part of the Innovation Accelerator in the NHS. We won a Pan-European award, the PDHA, in 2021, recognized as the best patient experience tool across Europe for recovery during COVID. We're one of the first 100 UK digital health tech companies chosen by DIT. And we were also invited to showcase our technology at the G7 this year in Cornwall. And we were one of 4 technologies that were chosen to do so. So we were really delighted. We've also had quite a bit of our work published in publications such as the HSJ, BMJ Quality and Safety, and most recently the Lancet eClinical Medicine, where our work was empirically proven to show how patient experience wisdom of the crowds significantly predicts the outcome of CQC inspections, as well as looking at variation in care experienced by those living with certain conditions, specifically obesity and overweight conditions versus the general population. So I'm going to hand over to my colleague Mark to talk a little bit more about what we do.
Yeah, no, thanks, Megan. I think just to reinforce the sort of some of what's different about what we do, never before has there been the same methodology for listening to patients across the whole of the country, which is amazing when you think about it. But every hospital today, or up to today, has had a different methodology and a different practice about collecting patient feedback, which has meant comparisons and comparing one hospital to another has not been possible before. So with our standardised methodology, it does really enable us to compare and benchmark different providers across the country, and from that really determine what's changing and what kind of variation is out there. And that's especially important as there's been so much discussion out there about levelling up services and the communities at large. And so what's really happening from a patient's point of view, and that's today what we're going to be lifting the lid and shining some light on that. So in terms of sort of what we actually do then, we collect data that is publicly available out there on the digital world that we can make sense of and collect. Most of that data comes from a few different sources, a whole raft of social media platforms, the likes of Facebook and Twitter, for instance, but also online review sites like nhs.uk and Google Reviews and many others that are out there too. And we collect all that data. In terms of volumes to that, we collect roughly about 1 million comments per month across about every single hospital up and down the length and breadth of the UK. So we start with this really fantastic data set. The challenge with all of that is making sense of it, and that is freely posted, spelling mistakes, one sort or another. We clean all that up and we make sense of all those different comments, and with those we allocate and tag them to the locations around the country, and we start to do a few things with them to really give them useful, actionable insights to the people who sort of want to really pay attention and learn about patient experience. We score everything 1 to 5 across all our activity. 5 is always the best, 1 is always the worst. And first of all, for every comment, we give it an overall score. But then after that, we do a few additional things that really add to the level of sophistication of what we do. We look and listen to the actual words that patients use and look to where they actually post it. And from those, we work out which department and what disease they might actually have and where they've been in the system. We also look at it from 8 internationally recognised quality domains, and these are things that really help us understand the different components of the patient experience and why that actually all matters together. And so these are things like getting fast access to healthcare services, emotional support, getting effective treatment, being involved in the decision making, and all of these different domains give a really nice 360-degree overview of what's actually really happening on the ground through their patient journey. And so sometimes patients might talk about 1, 2, maybe all of those different components. And with our AI technology that we use, we're able to segment and score one comment in multiple ways, depending on what's being said. With all of that, we do it in real time. So as soon as someone posts a comment, we will be picking that up and processing that with our technology. And that feeds into dashboards so that we can then track and understand not just what an individual is saying, although that's important, but the most important thing is what the whole audience, the whole crowd, or the wisdom of crowds effect is actually saying about any given organisation or any given department. And those scores are what feeds into our reports and what's been empirically proven to work before. Now, today we're just going to share, or sort of within this little film, four key headlines in terms of some of the data to really give you a bit of a sense and a feel for the types of things that will be in the report proper. And some of this is looking at it from the national picture, and then some of it really drilling down to some of the locations to give an understanding of where is the good practice and where are the places that really sort of a bit of learning and improvement are probably areas of urgent focus that might be recommendations. So let's leap in and look at some of this data. This first graph is looking at the overall patient satisfaction scores across England based around the regions that the NHS is configured in. And each line is a different region, and you can see the key down there at the bottom for the regions. We've got just about 2 years worth of data sitting on the graph running from left to right, with on the right hand side almost up to the present day, just a few days old in terms of sort of the final scores on the far right hand side. And to just help with take out some of the noise in the graph, what we're actually looking at here is a 90-day rolling average of the patient scores in each region over the time. There are 3 vertical lines you'll see dotted along there, and those indicate when the national lockdowns were across the country to see how they correlated with changes. And we can see therefore that there's a bit of time before COVID started at the end of 2019, beginning of 2020. All the regions start pretty static in terms of their lines, although there was already variation that you can see there across the country, with London being at the bottom of those lists and the southwest being at the top. After first lockdown, there was a surge in appreciation partly of the NHS, which partly triggered that uptick, significant uptick. But also when we drill down into the detail, what was also happening at the same time is there were fewer patients accessing healthcare services at that time, but those that were more than having their concerns met. The staffing ratios were particularly high, and people were actually waiting a lot less time for their services, maybe in A&E or elsewhere, than they'd previously been anticipating, all of which led to that uptick. Things settled down as sort of the summer wound through. And the second and third lockdowns did see a similar peak, albeit not quite as strong and significant as the first time round. However, when we come to the last 6 months, what you can actually see there is a significant deterioration of overall patient satisfaction in the services they received across all regions. And actually, compared to that mean dotted line that is the average for the last 2 years, sitting there at about 3.9 out of the 5, only the southwest is today staying above that average mean that we've had. The other things to highlight are London does track a significant way below the rest of the country, and why Londoners are receiving a sort of lesser level of patient experience is certainly one area we're particularly interested in. But also that variation has expanded over that time, and you can see on the right hand side there's much more variation and distance on the right hand side than back on the left hand side. And what we've also identified is that not only have services deteriorated, but the actual variation has increased. And roughly speaking, those that were good before COVID have been able to maintain a good service, but those that were struggling before COVID have been particularly impacted by the effects of it. And that has resulted in their patients having a particularly adverse experience as this has gone through. Obviously, to create this, we've got all the data by organisations, and this is the sort of aggregated up data to give you a sense of sort of the scene setting. I mentioned earlier on that we have 8 domains that we look at in terms of being able to theme it and look at it in different ways. And one that we're just sharing here now is looking at it from the speed of accessing services. It's obviously a really hot topic, given that there's around about 5.5 million patients now on elective waiting lists around the country. And our fast access score isn't just about waiting for elective services, it's waiting for an appointment, it's waiting in A&E, it's any component of waiting for those healthcare services that might come about. But what you can see is that as this year has gone through, and from maybe about Easter time onwards, there has been this real impact in terms of what's happening for patients in terms of that waiting time. And one thing that is really, I think, sort of an added benefit to this for the national picture is that there's been a lot of focus on monitoring or measuring the quantity side of those waiting lists, but what's actually the effect qualitative wise for those individuals and how are they doing? And whilst there's been a drop everywhere, you can also see that some areas are managing that waiting time and that access to services much better than other services. And I think that's something that's going to be really important to track over time as we recover coming out of COVID and get on top of these really pressing dynamic issues that sit around the healthcare system. A new insight, and something that we're really excited to share within our report, is the importance of patient experience in A&E across the whole of the hospital. And this is particularly important because of a couple of national strategic items. The first is that only last month there was, by the UK regulator, the CQC, there was a report that was published about A&E satisfaction. The problem with it was 12 months old from when the survey was done, and in such a dynamic, pressing year, data that's 12 months old is not really of use to anybody. And it's really important to have that real-time data, but also what we looked at was looking at the A&E experience and correlating it with the overall experience for all patients accessing a service, or accessing a hospital, sorry. And what you can see on this graph is a really strong correlation with, in the top right-hand corner, those that offer a good overall experience also offer a really good A&E experience, or vice versa. And in the bottom left-hand corner, you've got those that are struggling with A&E experience, but also overall experience. And for us, what we've identified is that A&E patient experience is a canary in the mine when it comes to the overall experience for an organisation. And not only do we need real-time data, which has not been provided by the regulator, what we also need is a really raised focus about the importance of A&E patient experience, which isn't actually an area that hospitals necessarily need to really spend time and focus on as part of their overall assessing of patient experience. Having this data in real time is invaluable to boards and indeed departments, so that they can really keep on top of their overall performance and make any remedial measures or effects that they need to do in a really timely fashion. The final bit of data just to share now is in the report proper, we will be sharing a full list of how all the hospitals rank up and down the country, looking at it through a few different lenses: specialist hospitals, the biggest hospitals, as well as the DGH smaller hospitals. But here we're just listing out sort of 10 of the acute hospitals across England, and looking at their pattern of positive and negative reviews that they typically receive. And you can see for that top 10, they by far have a much greater percentage of positive feedbacks than negative feedback, by about a ratio of 8 or 9 to 1 for all of those organisations. And a really big congratulations to all of them for having achieved such a fantastic level of service in such a trying and difficult year coming out of COVID. When we look at the bottom 10 trusts, and for the purposes of this diagram, they've all been grouped there in the bottom. By comparison, you can see that they almost have the same number of negative comments as positive comments that they receive, which is a dramatically different profile than the ones that have been most successful here. And so for them, what we've got is the ability to identify what they look like, but also from those comments start to give really meaningful actions about how they can actually improve and give a better service to patients.
So the report will be available on the 21st. And I guess what I really want to flag up here is that with the methodology shifting around how we try and understand patient experience, it's all the more important that we have this single-use methodology in real time with actionable insights to help the NHS and the wider healthcare system to really harness the benefits of patient experience and understand what it is that patients need in terms of delivering more effective and better access to care, whether it be in A&E or in maternity services, oncology services, and across the whole spectrum of care in the UK. And I think what we're here today able to offer is a real-time view on what's really happening and what really matters to patients most in the current health system. So I think that's one of the key takeaways.
What is your relationship with the CQC, and why do you think they're not using this method?
Well, this data could be very, very empowering for the CQC, and we think it's something that they should be paying more attention to in terms of what's publicly available out there. We do know historically they've looked at doing this themselves, and it hasn't been something they've actually been able to create themselves. So we would be delighted to actually support them with that. We know from the evidence that we've generated, it is a very powerful tool to be able to both predict and signpost where maybe inspections should be focused, both in departments and overall trusts. We don't yet have got to that point in our journey, but we'd be very happy if that was to happen.
You mentioned about your methodology and what data you're gathering. Could you explain a little bit more about what data is being gathered, and do you include personal information in that?
That's a really great question. Thanks, Catherine. So we are, in essence, data agnostic. So we can work with external data sets that are publicly available. So these are things such as Facebook, Twitter, NHS Choices, NHS UK, and the likes of anything else that's available on social media or in specific forums, whether it be disease condition forums such as cancer forums or maternity forums, etc. But we can also work with internal data sets. So whether that be survey data or SMS data that's being collected by the trust themselves, and we can aggregate that data together. For us, the important part is that it's real patients or their family and carers talking about real experiences of care in the system. And once we have that data, we're able to score it, theme it, and tag it using our algorithms that have been manually trained by healthcare professionals to recognize the language of the way patients speak about their care. And we never use any personal or hold any personally identifiable information or go on any private pages. So when we talk about social media, these are comments that have been left in the public domain where patients have actually flagged up, whether using a hashtag or an @ symbol, to the attention of the trust themselves. So you can imagine that looks like something like leaving my comment at Guy's and St. Thomas or at Tommy's in order to try and flag up to the hospital. One of the key issues with this from a methodological point of view is that this data can be very messy, very unstructured. It's not always left on official Facebook pages. So what we do and sort of add value to the system is we look across the whole spectrum of places where people could be leaving these comments. And that's what we think really adds a lot of power to the data.
Next question is, how can the data be used to improve services, and are trusts really using the insight to improve care?
Yeah, absolutely. So there's a few different ways that it can be used. At an organisational level, at a hospital level, we have a dashboard that they can access. They can see all their data. Not only can they see their data and how that's performing over time, but they can also benchmark themselves against other organisations to understand how they're doing relative to others. And within all of that, they can drill down all the way to the raw comments themselves to really get a really rich insight about the overall picture and how that works across the whole organisation. And from that, we know organisations that we're working with today use that to support their quality improvement initiatives and improving services more generally, and have found it a really, really helpful tool. We can also support the likes of NHS England, where we've worked with them, supporting them around the Cancer Collaborative. And we specifically looked at what can we learn about the difference in patient experience between those with rare and less common cancers versus those with more common cancers. And with our insights, we were able to identify and pick out not only variation between different regions in the country, but also practical ways that the less common and the rarer cancer patients were being treated differently to to the common cancers. And that's a really helpful, informative guide to really help train staff, recognise where there might be gaps in service provision, help recognise where communication might not be as strong as possible, and really sort of thinking through how the design of services can be best suited so that patients get the best experience. But also equally, if there are things that patients don't particularly value in the system, rather than maybe us guessing as healthcare professionals that they don't particularly like that, actually listening to patients and letting the patients inform decision making about how service should be configured in the future. If anybody's got any questions or want to follow up anything, please reach out to myself or Megan. Our contact details will be at the end, or alternatively Silverbuck, who are supporting us with this process.